I'm asked sometimes, what is the difference between a healthcare directive and a DNR and a POLST? So a POLST is a physician-ordered cessation of life support treatment. Historically, it was on cardstock hot pink, and it was provided to people experiencing hospice end of life, letting EMTs know to not put the paddles of life on me. Do not resuscitate me, DNR. And a POLST and a DNR cannot be prepared by a lawyer. They must be discussed and signed off by a physician. What I work on for my clients is gentler, less binding, and really speaks to who can be in charge. That's an Advance Health Care Directive. These go by different names in different states. In our Advance Health Care Directives, we talk about who can hold medical power of attorney, what sort of treatment should be utilized at the end of life, how clients feel about organ donation, and how they feel about a feeding tube. What we do not address within any of these documents is the right to die. That is a bit of a history lesson. California does have rights to die laws on the books as of 2016, along with about 10 other states, and only if the patient has been given 6 months or less to live. They've spoken with a doctor on 2 different occasions within a 48-hour period, and they still have the ability to give themselves the medication that terminates their life. Is that permissible? So I'm asked, can we put that into the documentation? My answer is no, not until there's a diagnosis in play and you meet these other criteria determined by California's Department of Public Health. This is all in response to the Netherlands, Holland, who has had this law on the books since 2002, and it's where we see medical tourism for those hoping to have assisted suicide. So these are the important discussions you need to have with an estate planning attorney who's going to put together a comprehensive healthcare directive, which may or may not have a do not resuscitate or a POLST, or in some rare instances for those on hospice, a right to die addendum.